All right, so we're gonna start with D1 for the upper extremity. So again, that starting position is gonna be extension, abduction, so away from midline, and internal rotation. And so this is D1 extension. And so then we're gonna move into D2 flexion, which is flexion, adduction, so adduction towards midline, and external rotation. Going down to extension, abduction, internal rotation, up to flexion, adduction, external rotation. So again, initially, we're passively moving here. You can use your body to kind of get a fluid motion going there. And again, you can switch hands midway to help keep the fluidity of that motion. Okay, so if you're going through passively, then you can have your patient start to help you, so doing active assisted. And then if you want, you can add some resistance to this as well. And again, that's that concept of rhythmic initiation, so going from passive to active assisted to active to resisted. All right, so for D2 upper extremity pattern, again, these are the diagonal patterns. You're going to start in D2 extension, which is extension, adduction, so toward midline, and internal rotation. And then you're coming up into D2 flexion, which is flexion, abduction, abduction, away from midline, and external rotation. So down into internal rotation, extension, and adduction, and then into flexion, abduction, external rotation. And again, I can get that fluid motion going. How you doing, patient?
Good.
Good. So again, I'm cueing my patient to relax, not to help me, because we're going through passively. Then I can ask my patient to start helping me a little bit. So try to go through this motion with me. So then we've moved into active assisted. And then again, I can apply resistance and ask the patient to push against that resistance. So for D1 diagonal pattern for the lower extremity, you're going to start in abduction, internal rotation, and extension, and then move into flexion, adduction, external rotation. Back down to extension, abduction, internal rotation, and then into flexion, adduction, external rotation. So we're moving fluidly through this position here. Again, encouraging my patient to relax as much as possible. Don't help me. Again, I want to get sort of a lunging motion going here, so I'm not tiring out my back or my arms. And then I can ask my patient to start assisting me. So doing a little bit of active assisted. And then I can add some resistance to that. So push into my hand here. Good, and come back up. Push into my hand here, and then pull back up. Good, and relax. For D2 diagonal pattern for the lower extremity, you're going to start in extension, adduction, and external rotation, and then you're going to move into internal rotation, flexion, and abduction. So again, going into external rotation, extension, adduction, into flexion, internal rotation, and abduction. So again, encouraging my patient to relax as much as possible, don't help me, and then I can get them to help me a little bit. Good, so doing that active assisted. And then I can add a little bit of resistance here. Good, pull down. Good, and relax. All right, so next we're gonna go over rhythmic stabilization. So you're gonna have your patient scoot towards you, which my patient already has, but have them come towards you. Then you're gonna tell them to point their hand straight up at the ceiling. So again, you can have them point with one finger, their hand can be all their fingers up, or they can make a fist, as long as they're keeping their target there. And again, we can do this at different angles, but for testing purposes, we'll have them at 90 degrees of shoulder flexion here. I'm then going to encourage my patient to squeeze their shoulder blade back and down. Good, so hold that position there, and then I'm going to apply a little bit of force at varying angles and encourage my patient to hold their arm right there. And relax, good. So for hold, relax, stretching for the hamstring, we're going to take the patient into that 90-90 position. So 90 degrees of hip flexion, 90 degrees of knee flexion, and then I'm going to ask my patient to relax as much as possible, and I'm going to take their leg into that stretch position right there where I start feeling some resistance from the hamstring. I'm then going to have my patient stay there for 5 seconds, just lightly going into that stretch. Then I'll instruct my patient to either meet my resistance or provide 50% effort to try to bend their knee or push into my hand. Hold that for 5 seconds and relax, and I'll come out of that and go further into that stretch position. You'll notice that my hip position or my patient's hip position isn't changing at all, and we're just trying to go into further knee extension there, stretching that hamstring muscle in the back of the thigh. So after staying there for 5 seconds, I'll have my patient push into my hand again and relax and go further into that stretch position. Good, relax. So for the hold, relax, stretch for the quads, you're going to have your patient laying prone, and then again instruct them to scoot towards you or towards the edge of the table. For this, again, I'm going to apply that stabilization proximally, and again, this is to prevent the hip from going into flexion if they have very tight hip flexors or quads. And so then I'm going to bring my patient's leg up into that flexed position there, again, until I start feeling that resistance. So again, this patient doesn't have a ton of resistance there in the quad muscles, but often with our patients, we'll start feeling that resistance right here. But again, go until you feel that resistance there. We're gonna stay in that stretch position for 5 seconds. And then I'm gonna have my patient, again, meet my resistance or do 50% effort for 5 seconds, pushing into my hand here. 3, 4, 5, and relax. And I'll take my patient further into that stretch position. We'll stay there for 5 seconds. And then I'll have my patient push into my hand again. 1, 2, 3, 4, 5, and relax. Go further into that stretch position. Some things to watch out for is, again, make sure that hip isn't popping off the table. Watch that knee position. Sometimes our patients will bring their knee out to the side to kind of compensate for any tightness they might have. So make sure you're keeping things lined up nicely and blocking that hip from popping into extension or external rotation. So for the scapular patterns, again, we're gonna do anterior elevation, posterior depression. So that's one of the ones we'll go over. So for anterior elevation, your hand is gonna be on that anterior glenohumeral joint, so right on the front part of the shoulder right there. And then posterior depression, your hand is gonna be right on that inferior angle or that medial aspect of the scapular, the shoulder blade there. So if I have my patient bring their arm forward, you can feel that border of the scapula, and then I'll have them relax back to neutral. So again, get your hands lined up just like that. I'm having my patient push up and forward into my hand here, good, and push back and down, good. Up and forward into my hand here, back and down, good. Push into that, good. Up and forward into my hand here, back and down. And again, we're applying that resistance and having the patient push into it within that pattern. Again, as you can see, I'm trying to get as much of this surface of my hand on that area as possible. So push up and forward, back and down. So again, that's gonna give my patient better feedback for what to push into. And as you can see, we're going in this pattern right here. So anterior elevation and then posterior depression. So then for the scapular pattern of anterior depression, posterior elevation, this hand is going to be right on that anterior inferior aspect of the shoulder area, so of the glenohumeral joint, kind of right in front of that axilla region. And then this hand is going to be kind of midway between the upper traps right there. So again, we're doing anterior depression, posterior elevation, so moving in this plane right there. And so you're going to ask your patient to push down and forward into that resistance. Good. Push up and back. Good. Down and forward. Good. Up and back. Down and forward and up and back. Good. Down and forward and up and back. Good. So again, anterior inferior glenohumeral joint near the axilla, and then other hand is midway between those upper traps, providing those cues to move into anterior depression, posterior elevation. So for the pelvic pattern, again, we're going to do anterior elevation, posterior depression. And so for this hand is going to be on the anterior superior aspect of my iliac crest, and then this hand will go on my ischial, or on the patient's ischial tuberosity. And so to find that iliac crest, you can palpate along the side of your patient here. You're gonna ask your patient if it's okay if you touch them on the side. And then you're gonna palpate down. When you find the lower ribs there, you can continue to palpate. There will be some soft tissue. And then that first bony prominence that you meet right there is gonna be the iliac crest. So again, I'm gonna go on the anterior superior aspect of that iliac crest. This hand is gonna go on the ischial tuberosity, or your sit bone. So that bone kind of right in the middle of the glutes right there. So again, it's okay if I put my hand on your glutes. So my hand is gonna go right here on that ischial tuberosity. And you'll feel that when you palpate that area, you feel that bony prominence there. So again, I'm gonna have my patient push up and forward into my hand here, good, and push down and back. Good, up and forward into my hand here, and down and back. Good, up and forward into my hand here, and down and back. And you'll notice that the hip shouldn't be rotating back and forth like that. The legs shouldn't be changing position. We're really trying to accomplish that motion at the pelvis right here. So it should just be the pelvis moving up and forward and down and back in that small plane right there. So for the next pelvic pattern, it is anterior depression, posterior elevation. So for anterior depression, there's a couple places you can put your hand. One is put it on that anterior aspect of the AIIS. The other is to put it right below the knee here, or you can put it on the greater trochanter. I believe I have better control and can give better feedback by putting my hand on the knee, so that's what I'm gonna do. So my hand's gonna go just here, and then my other hand is gonna go on that posterior aspect of the iliac crest. So we talked about how to find that iliac crest by finding the ribs, feeling that soft tissue, and then that next bony prominence you come to is gonna be the iliac crest. And so I'm gonna go on that posterior aspect of that iliac crest. So again, we're doing anterior depression, posterior elevation. So my hand is gonna go right here. I'm gonna tell my patient, okay, push down into my hand here, good, and push up and back, good. Down into my hand here, good, up and back, good. Down into my hand here, and up and back, good. And so again, you'll notice that the hips aren't rotating back and forth. There's not a change really in the leg position. It's all that movement is occurring in the pelvis, going down and forward, so anterior depression, and then up and back, that posterior elevation, accomplishing that pattern right there.